Hello friends, welcome to the channel Dewdear Academy. So this video is the continuation of the question paper discussion. M.Sc Nursing Entrance 2018 question paper part 4. The first question is, which of the following developmental task is proposed by Erik Erikson during middle adulthood? Which of the following developmental task is proposed by Erik Erikson during middle adulthood? Options: identity versus role confusion, generativity versus stagnation, intimacy versus isolation, integrity versus despair. So here we should know the psychosocial developmental task or psychosocial developmental theory by Erik Erikson. So what is the theory of psychosocial development? First, infancy, trust versus mistrust. Then in early adulthood it is autonomy versus shame. Then preschool, play age means preschool, it is initiative versus guilt. Then school age is industry versus inferiority. Then in adolescence it is identity versus role confusion. Early adulthood is intimacy versus isolation. Then adulthood. So here is our question, that is middle adulthood. It is generativity versus stagnation. And in old age it is integrity versus despair. So here in our question, the question is, during middle adulthood, what is the developmental task? During middle adulthood. Okay, middle adulthood, what is the developmental task? So here comes the answer, that is option B is the answer, generativity versus stagnation. Okay, answer is option B. During middle adulthood, according to Erik Erikson, the psychosocial developmental task is generativity versus stagnation. You can see here, generativity versus stagnation is during this adulthood or middle adulthood, it is generativity versus stagnation. Okay. Then the next question. The process by which the cultural traits spread from one culturally distinct group to another is. The question is, the process by which the cultural traits spread from one culturally distinct group to another. The cultural traits are spreading from one culturally distinct group to another. Options: evolution, assimilation, accommodation, diffusion. Evolution, assimilation, accommodation, diffusion. So please note in this question, the cultural traits, it is spreading. So if that means it is diffusion. The cultural traits are spreading from one group to another means that is diffusion. So answer is option D, diffusion. Okay, answer is option D, diffusion. Then what is evolution? What is evolution? So evolution means it is a process of gradual development in the particular situation or thing over a period of time. Evolution is a process of gradual development of a particular thing over a period of time. Then assimilation means the process whereby the individuals or groups of differing ethnic heritage are absorbed into the dominant culture of a society. So it is a process in which the individuals are getting absorbed into a dominant culture. Individuals or groups are getting absorbed into the dominant culture is known as assimilation. Okay, assimilation. The next, accommodation. In case of accommodation means the process by which the competing and conflicting individuals and groups adjust their relationship to each other. So adjusting the relationships to each other is accommodation in order to overcome the difficulties which arise in competition or conflict. So these are the definition of other options. So when you are preparing for the exams, please make sure that you are familiar with the other options also. In the question, you should get the meaning of other questions, other options also. Then only you will be able to study properly and effectively for all competitive examinations. Then the next question, the process of molding and shaping the personality of a human infant is called. the process of molding and shaping the personality of the human infant. Options: socialization, then acculturation, ethnocentrism, interaction. So here the answer is socialization, the process of molding and shaping the personality of an infant. Only by the process of socialization an infant is able to shape the personality. Okay, socialization is the answer. Option A is the answer. Then what are the other options? That is, acculturation means adoption of the behavioral pattern of the surrounding culture. Acculturation is the adoption of the behavioral pattern of other culture is known as acculturation. Then ethnocentrism. Ethnocentrism means it is a belief that the norms, values, ideology, customs and traditions of one's own culture or subculture are superior to those characterizing other cultural meanings. That means the feeling means of our own culture is superior to others. That is ethnocentrism. Okay, it is a belief that one's own culture is superior. It is superior to others. That is ethnocentrism. Then social interaction means it is an exchange between two or more individuals, and it is a building block of society. Social interaction means just an exchange between two or more individuals. Interacting between two or more individuals, that is social interaction. So in these options, the process of molding and shaping the personality of a human infant is through the process of socialization. Then the next question. The sociogram technique is used to study options: vocational interest, professional competence, human relations, achievement motivation. The sociogram technique. We know sociometry, it is a method for measuring the social relationship. So here the sociogram technique is used to study the human relations. So here the answer is option C. Option C is the answer, human relations. The sociogram technique is used to study the human relations. This is just an example of this sociogram technique or sociometry. It is a study of the interrelationship between people in a group. Then the next question. Which of the following is not the basis of natural inequality? Which one of the following is not the basis of natural inequality? Options: race, education, color, gender. So this is an easy question. We know the natural inequality involve the differences between one's human body and that of another. That means it is a product of nature, natural inequality. So in these options, race is an example of natural inequality. Also color is an example of natural inequality, and gender is also example of natural inequality. So the question, which one of the following is not the basis of natural inequality? The answer is option B. Option B is the answer. Education is not the basis of natural inequality. It is an example of a social inequality. Education is that means it is an example of social inequality, which is the expression of lack of access to education, healthcare, employment opportunities, status, housing facilities. All these are examples of social inequality. So here you can understand the difference. Natural inequality. What is natural inequality and what is social inequality? Okay. In natural inequality, we can give all these examples. That is the race, color, gender, all are natural inequality. And in case of social inequality, if there is improper or unequal access to education and also to the employment opportunities, then housing facilities, okay, housing, then healthcare. So for all these cases, if there is improper access or unequal access, means that is known as the social inequality. Then the next question, which one of the following is an example of Ascribed status. Ascribed status. Options: Brahmin, student, teacher, doctor. Which one of the following is an example of ascribed status? This is also another easy question. That is, ascribed status, we know that is the social status of a person that is assigned at birth. The social status of a person that is assigned at birth is known as the ascribed status. It is assigned at birth. Okay. Then we know what is achieved status. There is ascribed status and achieved status. Achieved status means which is not assigned at birth, but it is based on the personal ability and merit the person is achieving. The status that the person achieved, which is based on personal ability and merit. Okay, that is based on the personal ability and merit. That is achieved status. So from these options, we can clearly understand the options B, that is the student, teacher and doctor. These are all coming as achieved status, and Brahmin is an ascribed status. Ascribed status, which is assigned at birth. Okay, so which one of the following is an example of ascribed status? The correct answer is option A. Then the next question. Which one of the following is an existential element for the existence of which one of the following is an essential element for the existence of the society? Essential element for the existence of the society. Options: high level of education, then belief in common political ideology, sociability among the members, share in the property. So, high level of education or belief in common political ideology or share in the property, these are not considered as the most important or essential element for the existence of the society. But the option C, that is sociability among the members. Sociability among the members is the answer. It is the essential element for the existence of the society. So the answer is option C. Sociability among the members is the essential element for the existence of the society. Then next question. Which type of test is used to predict the extent to which a person can succeed in a particular field of work? Which type of test is used to predict the extent to which a person can succeed in a particular field of work? The question is how a person, or what is a test that helps to identify whether a person can succeed in a particular field of work? Options are attitude test, intelligence test, aptitude test, memory test. So first we should know what is attitude test. Attitude test is helps to determine or to assess the attitude or belief. So attitude, first we can see what is attitude test. Attitude test means it helps to assess the attitude or belief of a people. Attitude or belief of an individual. One example for the attitude test is Gutman scale. Just note down just the example for attitude scale is Gutman scale. Gutman scale means it measures how much of a positive or negative attitude a person has towards a particular topic. Okay, that shows the Gutman scale is an example of attitude test. It helps to measures how much of a positive or a negative attitude a person is having towards a particular topic. Then we know intelligence test. What is intelligence test? That is, it helps to assess, or it is the age-related series of problems whose solution involve arithmetic, memory and vocabulary skills. That is, in terms of IQ, it is mentioned in the intelligence quotient. Okay, in terms of IQ, intelligence test is assessed. That is, just the example is Stanford Binet intelligence test. Stanford Binet intelligence test is an example of the intelligence test. Also Wechsler's intelligence scale. Wechsler's intelligence scale is another example. Wechsler's intelligence scale. Wechsler's intelligence scale is an example of intelligence test. The next is aptitude test. What is aptitude test? It is a test that is designed to determine the person's ability in a particular skill or field of knowledge. the ability, person's ability in a particular skill or field of knowledge. Okay. So in our question, the test that is used to predict the extent to which a person can succeed in a particular field of skill or work, that is aptitude test. Okay, skill or in a particular field of knowledge, that is aptitude test. Example like the general aptitude test, the numerical reasoning test. These are all just the examples of aptitude test. So here the answer is option C is the answer. Option C is the answer, aptitude test. Then what is memory test? Memory test is just to assess the ability of an individual to store, retain and recall the information. The ability of an individual to store, recall, retain and recall the information is memory test. So from this we understand what is the aptitude test and what is intelligence test, aptitude test and memory test. Here this question the answer is aptitude test is the answer. Then the next question. Positive Trousseau and Shostak sign are seen in options hypercalcemia, hyperkalemia, hypocalcemia, hypokalemia. We know positive Trousseau and Shostak sign are seen in case of tetany. These are signs seen in tetany. What is tetany? Tetany means it is a symptoms characterized by muscle cramps, tremors and spasm. Okay, muscle cramps. Then tremors and spasm is found in tetany. Mainly it is caused by low calcium level. These tetany or the muscular spasm or involuntary contraction of the muscles are due to the low calcium level. And in case of low calcium levels, in case of tetany, the two important signs seen is Trousseau sign, positive Trousseau sign and Shostak sign. What is Trousseau sign? It is the carpopedal spasm. Okay, carpopedal spasm which is caused by inflating the BP cuff to a level above systolic pressure for 3 minutes. It is a carpopedal spasm caused by inflating the BP cuff to a level of above systolic pressure for about 3 minutes. And this is a sign of tetany. And also we can see Shostak sign. Shostak sign means what is it? Is a facial muscle contraction. Shostak sign means it is a twitching of the facial muscles in response to tapping over the area of the facial nerve. Or it can be the facial muscle contraction. That is also a sign of tetany which is seen in hypocalcemia. It is a sign of tetany. Sign of tetany that is seen in hypocalcemia. So in this question, in our question, these two signs are seen in. The answer is option C. Option C is the answer, hypocalcemia. Hypocalcemia is the answer. Then the next question, a nurse identifies that the patient's pressure ulcer has just partial thickness skin loss involving the epidermis and dermis. What stage of pressure ulcer should the nurse document in the nurse's record? Options stage 1, stage 2, stage 3 and stage 4. The nurse identifies that the patient's pressure ulcer has just the partial thickness skin loss involving the epidermis and dermis. So here you should know the stages of pressure ulcer. There are mainly 4 stages. First stage is stage 1, that is non-blanchable erythema of the skin, just the redness or erythema. Non-blanchable erythema of the skin is the stage 1. Then stage 2 means partial skin loss of the epidermis. Stage 2, there is partial thickness skin loss involving epidermis, dermis or both. That is the stage 2. Partial thickness skin loss involving epidermis, dermis or both. So here we can see the blisters. The ulcer is superficial and also it presents as abrasion and blisters. Then stage 3. Stage 3 means it is the full thickness tissue loss or skin loss. Full thickness skin loss is seen in stage 3. Full thickness skin loss can be seen in with damage or necrosis of the subcutaneous tissue. You can see damage or necrosis of the subcutaneous tissue, that is stage 3. So in this picture it is clear, stage 1 just redness or erythema is there, and in stage 2 there is partial skin loss of the epidermis and dermis, And in stage 2, then in stage 3 comes the full thickness skin loss with the damage or necrosis of the subcutaneous tissue. That means the subcutaneous fat may be visible, but here the bone, tendon or muscle is not exposed. In stage 3, the muscle, bone and tendon is not exposed. But in stage 4, there is full thickness skin loss with necrosis or damage to the muscle, bone and a supporting structure. That is stage 4. Okay, that is stage 4. So we know stage 1 is just the non-blanchable erythema of the skin, and stage 2 means there is partial skin loss of the epidermis, dermis or both, and also there can be blisters. Blisters can also be seen here. And in stage 3, there is full thickness skin loss with the loss of the subcutaneous tissue. And in stage 4, there is full thickness skin loss with damage to the muscle, bone and the supporting structures. So with this knowledge, we can see what is the answer for this question. At what stage of pressure ulcer we can see the partial thickness skin loss involving the epidermis and dermis. So here the answer is option. Yes, option B is the answer. Option B, that is stage 2. Then the next question, the ratio of potassium permanganate solution for mouth care is. The ratio of KMnO4 solution for mouth care is. Options 1:5,000, 1:1,000, 1:2,500, 1:3,000. We know potassium permanganate, it is a strong oxidizing agent and it has some disinfectant properties also. It is used in case of for the sterilization of instruments. It is used then for wound irrigation, then for gargles and mouthwash it is used, for mouth care it is used, and also there are various other disinfectant properties also, and it is an oxidizing agent. So here for the mouth care or for the for the mouth gargles or for mouthwash, 1:5,000 is the ratio used. The ratio of KMnO4 used for the mouth care is 1:5,000. So the answer is option A. So these are the important questions I am discussing in this video. So thank you for watching this video.